Governor Asa Hutchinson expanded the universe for vaccines to the 1C group this week as COVID-19 numbers still remain in check. The new vaccine expansion adds another 1 million Arkansans to the eligibility list. I caught up with Dr. Chad Rodgers, medical director for the Arkansas Foundation for Medical Care, who was at one of their vaccine clinics to discuss. Let's reflect back. It has been a full year since the COVID-19 crisis hit Arkansas, March to March. We are all looking back at what has happened over the last year. What strikes you as most significant, most profound as you look back?
Right. It's been a bit long year. We had daylight savings time the other day. I said some people feel like they lost an hour. I feel like I lost a year, but it's been a tough year. It's sort of interesting. I was kind of reflecting on this the other day, and when I was kind of thinking about what we're going to talk about today. About 20 years ago, I was sitting with a colleague who was working for an insurance company who was working on disaster preparedness. And one of the things he brought up was, that there would be this pandemic, and, talked about the Spanish flu. And I even having recently finished medical school, I didn't know a lot about the Spanish flu and what had happened at that time. And when he kind of talked to me about it, I didn't really believe that was going to happen. I mean, certainly, I had been exposed to the flu. I've had the stomach virus, and I survived. Didn't really ever think there would be this sort of novel virus that would come through and cause so much trouble. I think, one thing, it has had a tremendous impact on our healthcare system, but I didn't really anticipate the impact that it was going to have on our economic or, just the psychological part, just the overall wellness of people. I think it's hard to believe that we've gone through a whole year of being quarantined and dealing with a pandemic, and the implications have just been much broader than I ever thought.
That's been tough. I think about the over 5,400 people whose lives have been lost too. I mean, that is just an incredibly large amount of people who have died because of one particular disease in such a short period of time. But we do have vaccines now. You're at a vaccine clinic in Searcy, as a matter of fact. Tell me a little bit about what the experience is like at that. And then I want to ask you some broader questions about vaccines.
Sure. So, it's exciting if you think about everything that's happened within the last year. The fact that we have a vaccine within 1 year of the first case in Arkansas is just kind of phenomenal. It's a great part of science and technology. So, yeah, I'm at Searcy today. They're doing a vaccine clinic here for AFMC, is sort of supporting along with the Fellowship Bible Church and Unity Health. Huge turnout. Of course, the governor expanded the group yesterday to the 1C category. And so they just have a lot of people. And I think people who want the vaccine are getting the vaccine, which is very rewarding to see. Actually, the level of excitement is a little hard to explain because people are so thankful to be getting the vaccine. Our first vaccine experience is that, grandparents were, hoping to get to see their grandchildren. Then you have people who just want to, protect others by getting vaccinated. They don't want to get sick. So I think we're getting more data about it. But it's really exciting. So, I think there's still a lot of misconceptions about vaccination out there, that this vaccine was developed kind of quickly, and that it didn't go through all the usual channels. But these vaccines are going through, even though they're getting emergency use authorization, there's still, the number one goal is safety. The second goal is, that they're effective in preventing, number one, getting sick, getting hospitalized, ending up on a ventilator. I think that that data is well known, and that the vaccines were not just kind of quickly developed, but were based on previous vaccine technology. So I think we can feel pretty good that I have actually had the vaccine myself. I had the Pfizer vaccine, and have been fine. So certainly encourage others to get their vaccine.
So we did see from the governor when he made that 1C announcement that our vaccine adoption rate in the state is still relatively low. I think only about 10% of the state is fully vaccinated at this point in time. What do you, with him opening up 1C, with the fact that manufacturing and production of vaccines are going to increase because of the Biden administration's push on this, what do you expect to happen over the next month or two?
Yeah, again, I think the first two groups, the governor and the health department, kind of opened the groups up to people who wanted the vaccine, hopefully got it or had access, and I think we've definitely kind of worked towards that. But the more people who get vaccinated, the more you get to this herd immunity, and so by expanding to a larger group. Because there are a lot of people out there who want to get vaccinated, and even though they may not be in a high risk group, they may not be elderly or have other healthcare complications. By getting vaccinated, they create that herd immunity, the percent of the population that sort of needs to be reached in order to protect yourself and to protect others. I think it's really good. It's a big group, and I think we're all kind of rapidly trying to respond to the demand for people who want to get vaccinated. Again, very safe, very effective, good thing to do for not only yourself, but for the community.
Lastly, I think we have 3 vaccines that are have this emergency use authorization. There is a news that there is a new drug to fight the virus. Tell folks a little bit about that. I don't think it's gotten quite the same amount of attention.
Right, so that is kind of fresh off the press. And so definitely a new kind of antiviral. People kind of compare it to the Tamiflu version for the flu. So if you are diagnosed with COVID, getting on this antiviral very quickly may reduce your risk for getting more sick or maybe even lessen your symptoms. The other thing is the monoclonal antibody for people who are really at high risk. Once they're diagnosed, they could quickly get referred. So the new one is something you would actually take at home. It would be a pill that you would be prescribed by your physician if you were uh, uh, tested positive for COVID. The coastal monoclonal antibodies for high risk populations and has to be done through an infusion center. But it's sort of, I mean, I of course I went into medicine, so I'm a big science nerd. It's kind of cool to kind of see how quickly these therapies rolled out and are being used and that are effective. But again, they're based on years and years and years of research and technology that we already sort of had. So my message to people is that we're not just kind of shooting from the hip here. We're like, actually, there's good science to show that these treatments are effective and that they're safe.
All right, Dr. Chad Rodgers, Medical Director for the Arkansas Foundation for Medical Care and well-known science nerd. Now, thank you.
Well-known science.
Appreciate you so much.
All right, thank you, Robbie.